Hello everyone, and welcome to this audio podcast. This audio podcast is part of the Loop Remit series. This audio podcast is part of the Labosztix Bloca. This audio podcast is part of a Labosztix view. This audio podcast is part of a Storm Labosztix production. This audio podcast will go into looking at long-term conditions or long-standing conditions and disability in context of uh, in context of uh, in context of healthcare. So an estimated of 15 million people in the United Kingdom alone have at least one long-term condition or long-standing condition. These patients have accounted for around 50% of general practitioner appointments, 64% of outpatient appointments, and around 70% of hospital admissions. Around 70% of total healthcare expenditure in the United Kingdom is attributed to people with long-standing conditions. People diagnosed with a number of with several long-standing conditions or long-term conditions are perhaps documented and literature informs are perhaps the most sort of in sort of intensive service users in around healthcare because the needs are usually more complex than those of people with single diseases. And before sort of going on to inform if before going on to inform that those that young people in context of pediatrics and young people who are diagnosed with certain disabilities and conditions, and then sort of grow up. As they grow up, if they have that opportunity to grow up, that is, will end up living with long-standing conditions or long-term conditions and disabilities throughout their lives versus those in the general adult population. So people diagnosed at the same time with a number of long-term conditions, long-standing conditions, again, tend to be the most intensive users in around healthcare services because of the complexity because of complexities. Now, most people aged 65 and over 65 and over can have multi-morbidities, although a Scottish investigation have found the absolute number of people with multi-morbidity was actually higher in those aged under 65, including its implications for the population as a whole. So the number of people with multiple long-standing conditions or long-term conditions known as multi-morbidity again has been set to increase or rise from 1.9 million in 2008 to 2.9 million in 2018. This consequently has an impact beyond health itself or healthcare itself. Long-standing conditions or long-term conditions also prove to be within another special sort of division. According to Article 1 of the United Nations Conventions on the Rights of Persons with Disabilities, or UNCPD, persons with disabilities include so include and it, include and where this is a direct excerpt from the UNCPD. Those who have long-term physical, mental, or intellectual or sensory impairments, which in interaction in interaction with various barriers or hindrances may also hinder the full and effective participation in society on an equal basis with others. The World Health Organization, or WHO, Global Disability Action Plan now becomes important now becomes important now becomes important here also. So an excerpt from the WHO, the World Health Organization Global Disability Action Plan, is as follows. Is as thus: across the world, more often than non-disabled peers, people with disabilities do not receive the health care they need and have they need and can and have and sort of consequently can have poorer health. People with disabilities are more than twice likely to find healthcare providers skills and facilities skills and facilities inadequate, and nearly three times more likely to be denied healthcare, and four times more likely to be treated badly. And so, specifically in the West, persons with disabilities tend to report more access to healthcare problems than persons without disabilities. The problems tend to be most common amongst those with the poorest health and those with the most severe disabilities. According to one author, one author in sort of peer review works, it is imperative that healthcare and policy makers, planners and providers understand and address the needs of people with disabilities as a distinct category of healthcare consumers. And putting all this in context, the prevalence in around CKD, or chronic kidney disease, and amongst other primary conditions, have been increasing most quickly. And at the same time this at the same time increasing more quickly, have been increasing more so in amongst between pediatrics and young people, but pediatrics and young people, and amongst the general sort of young adult population. So now in around looking at looking at and now sorry and now looking at into now looking into or now looking into sort of discrimination and ignorance, more specifically.